anyone you know ever had complications throughout any point in their pregnancy? High-risk complications happen way more than you probably thought they did. You should listen because high-risk complications during a pregnancy are very common and they could possibly happen to you at some point in your life. As for myself, I cannot wait to become a mother one day, and I believe everyone should be aware of some of the complications that could happen. Some complications to be concerned about during your pregnancy are experiencing preeclampsia, bleeding of any kind, and gestational diabetes. Every pregnancy is different, but some people experience many complications like preeclampsia. Preeclampsia could be very dangerous and even fatal for you or the baby if not treated. You are more likely to experience preeclampsia during your first pregnancy if you are a teenager or if you're over 40. Preeclampsia is a condition in which you experience high blood pressure and do not normally have high blood pressure. Swelling in the face, feet, and hands are a result from this. Some symptoms you might experience during preeclampsia are having severe headaches, a change in reflexes, dizziness, reduced urine output, and vision changes. An article from the Journal of Midwifery and Women's Health, November 2014, states, "It is a leading cause of maternal mortality, infant prematurity, and fetal growth restriction in the United States. Although preeclampsia is classified as a hypertensive disease of pregnancy, to view it primarily as a blood pressure problem is incorrect. It can have a serious effect on the liver, kidneys, brain, and lungs." The next factor, bleeding, can be a huge complication in any pregnancy. Bleeding of any kind during a pregnancy could be really serious. In this situation, always go to the hospital to get checked out in order to make sure everything is okay with the baby. If you experience vaginal bleeding when pregnant, it is very important to figure out exactly what it is from, because in some situations you could be miscarrying the baby. A Scandinavian OBGYN, November 2012, said, "Bleeding in the first 20 weeks of pregnancy is a common complication affecting about 1 in 5 pregnant women and is of clinical relevance as these women have increased risk of adverse outcomes, particularly placental abruption, low birth rate, and preterm delivery." Finally, we see that diabetes is something that can happen in your pregnancy. Gestational diabetes can only occur during your pregnancy and will not always result in diabetes after the pregnancy is over. There is a couple of different methods to treating gestational diabetes, such as checking your blood pressure, your blood sugar 4 times a day, exercising more often, change your dietary plan to what your doctor recommends, and your doctor will track your weight gain throughout the pregnancy. International Journal of Endocrinology and Metabolism, July 2016, stated, "Gestational diabetes mellitus is one of the most common complications of pregnancy, and its prevalence widely varies worldwide. According to the study population and the diagnostic test used, the prevalence may range from 2.4% to 21% of all pregnancies. All of the complications I've discussed today can happen to anyone during a pregnancy and are very high risk." We now know that some complications you may experience during pregnancies do not all have a treatment, but there are ways to help with it. Always be aware of what is happening with your body in order to keep you and your baby safe. 3 high-risk complications you may experience during pregnancy are preeclampsia, bleeding, and gestational diabetes. The complications that I discussed today are way more common than you probably thought. So if you experience any of the symptoms listed or have similar problems during your pregnancy, you should see your doctor and discuss whether there is a treatment or not. It is very important that you know what is wrong with your body when carrying a baby. For further questions about these, you can visit www.webmd.com for answers.